Do you or someone you love suffer from a chronic illness? In today's episode, we will explore strategies to improve sleep quality in cases of chronic illness, addressing the multifactorial nature of sleep disturbances and the considerations specific to managing sleep in this population. I'm Jay, and this is Somnilopod. Hello, everybody. Welcome back. Glad you joined me. I want you to think back to the last time you were sick. I think for me, I had a little bit of a stomach flu a little while back, and just couldn't sleep, couldn't get comfortable. Of course, was constantly getting up and going to the restroom. But one of the issues that I have always dealt with whenever have been sick has been being able to sleep. So I wanted to take a little bit of a look at people with chronic illnesses and how sleep is affected in that population. Sleep disturbances are prevalent among individuals with chronic illnesses, contributing to a myriad of adverse health outcomes and exacerbating symptoms. The management of sleep disturbances in the context of a chronic illness presents unique challenges that require tailored interventions and comprehensive approaches. Chronic illnesses encompassing conditions such as diabetes, cardiovascular disease, autoimmune disorders, and neurological conditions can significantly disrupt sleep architecture and quality through various mechanisms. Pain, inflammation, medication side effects, psychological distress, and physiological abnormalities contribute to the development and perpetuation of sleep disturbances in individuals with chronic illnesses. Moreover, the interplay between the underlying pathophysiology of the illness and disrupted sleep further exacerbates symptoms and diminishes overall well-being. Now, there are numerous ways in which to address sleep quality issues in chronic illness. And honestly, these individuals can't afford not to address these issues, given the important role sleep plays in restoration and recovery. A holistic approach that includes collaboration between healthcare providers from various disciplines, including primary care physicians, specialists, psychologists, and sleep specialists, is essential for addressing the complex interplay between chronic illness and sleep disturbances. Comprehensive assessment and individualized treatment plans that address the underlying causes of sleep disturbances, comorbid conditions, and medication management and behavioral factors are paramount. You've heard me say it before, but educating individuals with chronic illnesses about sleep hygiene practices is fundamental for promoting healthy sleep habits and optimizing sleep quality. This includes maintaining a consistent sleep schedule, creating a conducive sleep environment, limiting exposure to stimulating activities before bedtime, and adapting relaxation techniques to facilitate sleep onset and maintenance. For those suffering specifically with insomnia, CBTI, cognitive behavioral therapy for insomnia, is an evidence-based therapeutic approach that addresses maladaptive thoughts, behaviors contributing to insomnia and sleep disturbances. Tailored CBTI interventions that incorporate cognitive restructuring and stimulus control, sleep restriction, and relaxation techniques have been shown to improve sleep quality and reduce insomnia severity in individuals with chronic illnesses. In cases where non-pharmacological interventions are insufficient to address the sleep disturbance, and let's face it, sometimes medication is the answer, but judicious use of pharmacological agents may be warranted. However, careful consideration of potential interactions with existing medications, side effect profiles and individualized titration or dosage is essential to minimizing the risks and optimizing those therapeutic benefits. You can't address sleep issues without looking at psychological factors such as anxiety, depression, and stress. They're common among individuals with chronic illness and can significantly impact sleep quality. Integrating psychosocial interventions such as the CBTI, cognitive behavioral therapy that I mentioned, and mindfulness-based stress reduction, relaxation techniques into the treatment plan can help address underlying psychological factors contributing to the sleep disturbances. Now, in cases where individuals with chronic illnesses face additional challenges, such as mobility limitations and cognitive impairment or palliative care needs, tailored approaches to improve sleep quality are going to be essential. This may involve adapting sleep hygiene recommendations to accommodate physical limitations, providing supportive care measures to alleviate symptoms, and integrating palliative care principles to enhance comfort and quality of life. Improving sleep quality in cases of chronic illness requires a multifaceted approach that addresses the underlying pathophysiology, comorbid conditions, and medical management, as well as behavioral factors contributing to sleep disturbances. And by implementing comprehensive strategies mentioned previously, healthcare providers can effectively mitigate sleep disturbances and enhance the overall well-being of individuals with chronic illnesses. Tailoring interventions to the specific needs of specific populations ensures that individuals receive personalized, evidence-based care to optimize their sleep quality and quality of life. If you know someone who has a chronic illness, please touch base with them, help them to understand and to maybe reach out to their primary care doctor to address their sleep issues. I promise it will make things at least a little bit better. I hope this has been informative for you. Please, if you have any questions, comments, concerns, reach out to me. You can touch base with me at j@somnilopod.com. You can also reach me through the socials, Instagram and Facebook. And until we talk again, please remember to make sleep a priority.